I get all the time. What exactly does mobilization mean in a nursing context? People sometimes picture exercise or just getting up and walking, but there's a lot more to it, right?
Definitely, and I'm glad you brought that up. In nursing, mobilization is much broader. It covers all those planned activities aimed at keeping or restoring someone's ability to move and stay independent, even if that just means small movements in bed after surgery. It's about making sure patients don't lose function and preventing complications like pressure sores or blood clots.
That makes sense. So, we're talking everything from helping a patient roll over to supporting them as they take their first steps after a big operation, right? It sounds like it really is a central task for nursing teams.
Exactly, it's woven into day-to-day care. Nurses are actually on the front line when it comes to catching early signs of immobility or helping patients progress safely. And because every patient's situation is different, deciding how and when to mobilize is always a bit of a balancing act.
Speaking of differences, what are the main principles to keep in mind when we talk about mobilization? I've heard terms like resource-oriented and individualized thrown around, but what do they really mean in practice?
Those are crucial. Resource-oriented means focusing on what the patient can still do instead of just what they can't. So maybe someone can sit up with support or use one arm better than the other. And individualized care means tailoring the approach to their physical and mental status. So, for example, someone with dementia needs a different strategy than someone recovering from minor surgery.
I love that angle, meeting people where they are. But I imagine there are a bunch of obstacles that can pop up, right? Pain, confusion, not enough staff. It adds up fast.
Oh, absolutely. Sometimes the biggest barriers aren't physical, but organizational, like time constraints or lack of training. And on the patient side, fear or low motivation can also put the brakes on. That's why ongoing education and collaboration with other professionals like physios is so important.
That actually reminds me of training. How do care facilities teach mobilization so it really sticks? I'm curious what that looks like beyond just learning the moves.
Great question. Effective training mixes theory and hands-on practice. So it might start with a classroom session about why mobilization matters, then move into case studies and real-life scenarios, like practicing transfers from bed to wheelchair, or role-playing how to motivate a patient who's anxious.
So, not just a one-and-done thing. There's actual feedback and evaluation, right?
Exactly. There are several layers: self-assessment, observation by instructors, and practical exams like demonstrating a safe transfer. Plus, reflection is built in, so caregivers can think about what went well and where they can improve. The idea is to build both skill and confidence for real-world care.
Funny you mention real-world care. I've heard a lot about the BOBIT concept, especially with patients who have neurological challenges. Can you break down what that looks like in a care setting?
Absolutely. The BOBIT concept is a specialized approach for people with brain or nerve injuries, like after a stroke. It's all about encouraging normal movement and avoiding those awkward compensatory patterns that can set in. For example, rather than letting a patient always favor their stronger side, you support and stimulate the weaker side so the brain can relearn better movement patterns.
So it's super personalized, setting goals based on what the patient can handle and always adapting. I like that it's not just about getting through daily tasks, but about relearning, regaining independence, and even helping with things like balance and sensory awareness.
Exactly. And it's truly interdisciplinary. Nurses, physios, occupational therapists, and families all work together. The ultimate aim is always the patient's everyday quality of life, not just ticking off exercises.
Let's bring this home with a real-life example. Say we have someone like Mrs. Miller. She's 86, just had a hip replacement, has mild dementia, and needs a lot of support. What does safe, effective mobilization look like for her?
Cases like Mrs. Miller's are really common, and they highlight how complex mobilization can get. First, her team would assess risks, so her pain level, confusion, balance, and fall risk. They'd use aids like a rollator, involve her in small tasks like sitting up and washing, and use BOBAT positioning for her weaker side. And they'd loop in her daughter for support and clear communication.
And of course, all of that gets carefully documented so everyone on the team stays in the loop. I'm always amazed at how much thought goes into each step, especially with the goal of keeping someone safe, but also as independent as possible.
Exactly. It's never just about moving someone from point A to B. It's about supporting their dignity, motivation, and long term recovery. And that's really at the heart of good nursing care.